This is Gaza.
Assalamu alaikum, everyone. I think everyone knows me. First and foremost, thank you to everyone for being here. You're wondering what that was. Everyone asked me, what was it like when you entered Gaza? That's what it was like, 100 times louder. The minute we entered, it was drones all over the place. We entered at nighttime. We just heard this constant buzzing, and we heard it for the 9 days we were there. The drones are all over the place. And then occasionally you would hear the bombings, and you would hear the missiles, and you hear the strikes. So we wanted to share that and think about what it sounds like from my experience when I was there in Gaza. Again, everyone's been asking me what's it like in Gaza, what it was, and I was in Buffalo last night. Cengiz put our presentation together, so I already cried a lot, so it's, when I saw that video, they surprised me with a video. It was a pretty emotional night talking about this, so I want to apologize in advance, but I want you all to understand, because you always ask, what's it like? Well, this is Gaza. For me, Gaza was very, very, very personal since 2009, and many times I've gone. After October 7th, I found myself extremely angry. I found myself extremely sad. Those who know me know I'm always joking and lively on the most part. I found myself withdrawn at times. Maybe you'll call it depression, as doctors don't like to ever say that we ever get that way. I just had so many emotions that even my wife, my children, I couldn't share them with anyone. They were just there. And then, Imana was able to start setting up to procure supplies and deliver aid, and that was tough. It is so tough to get stuff into Gaza, but alhamdulillah, with our relationships, our diplomatic connections, we started getting stuff in, and I found purpose. I found purpose, and I think that drove me away from my sort of those dark times that I was feeling. I wanted to see, in addition to helping and doing that, that's obviously, I'm a healer, that's what I do as a doctor. I wanted to see my friends. I thought about them a lot. And seeing them was the most rewarding thing, that they were alive. I got to hug them. They came. They're not in good shape. They're going through tough times, but they were so happy to see me. So I got to see every single one of my friends. So besides, in addition to everything else, that was the most rewarding thing for me. That's my theme. 35,000 have been killed, 80,000 are injured, 10,000 are missing, 8,000 children, 5,000 women, 2,000 elderly. And as we were sharing in the video, it's personal. It's personal to Imana. We've been in Gaza since 2009. We work in 40 countries around the world, but Gaza is special to us because we were the only American medical team to enter in 2009. I was part of that team. And since then, I've been back 5 times. I'm not Palestinian, but I proudly would be one. And it's personal for me because of all my friends, and they're like family there. So that's Gaza right there. That's the numbers. So now imagine you are home, and these are pictures from Khan Yunis. I took some of these pictures. I was driving through Khan Yunis, and all of a sudden, our first night, we were in our room, and we hear a massive explosion. It shook our room, and we knew that there was a strike, and we ran to the emergency room. And when we got there, and this was happening, I was there 9 days, every night from 11 to 2 in the morning, we would be taking care of mass casualties. And this is Gaza. I had to intubate him, replace the breathing tube. His children were coming in. It was families. It was aunts and uncles. I mean, they would just come in the masses. And there would be someone screaming, take care of my aunt, my grandfather. Some were dead on arrival. Others were dying as we were working on them. And then there was the ones we could save. So again, if you want to know what Gaza is, this is Gaza. This is what was happening. That's a child. And I remember vividly this day because there was a mother. Her name was Mahal. And I'm going to give you guys names because our media, the social media, the CNNs, the Fox News, everything, they'll never give you names. They'll just give you numbers. These people have names, and we should know their names. So there's a mother, her name was Mahal. She was concussed, her house was hit, she was bleeding out of her ear, and we thought she had a traumatic brain injury because she was in and out. And immediately we were trying to get her to the CT scanner, and she says in clear English, please save my child, save my son. And so myself and Sharik ran over just to check her son. You know, this is Gaza. She lost her husband and her eldest son in that strike. And so her son had a skull fracture, but he was stable, and you know, alhamdulillah, he was fine. But you want to ask me what Gaza is like? This is Gaza. We get these strikes all over the place, every day. You know, very quickly, in 24 hours, I was able to tell what's a drone strike, what's a bomb being dropped by an F-16, and what is a tank firing. I can tell you right now, if I hear those sounds, I know what they are. So you have all these displaced people, and I was at European Gaza Hospital, and people, imagine Strong Memorial, and there's 30,000 people who are living either inside or outside the hospital. Take like Elmwood and you know the roads down there by the University of Rochester Hospital. People are living there, they're seeking refuge there, hoping that this hospital doesn't get hit like Nasser and Shifa. And this is one of the first things that we saw the next day was, this is inside the hospital. So imagine you're going to hospital, there are sheets up. These are people living there. These are their homes now. They're living there trying to be safe. And now imagine as physicians, we're trying to, with emergencies, trying to take patients down these. And I've never seen anything like it. I've been on 36 medical missions all around the world. I've never seen a hospital, a facility, basically become a housing complex. This is Gaza. And remember, names matter because the media is never going to give you a name. They're going to give you a number. It gets hit, you're home, and your 10-year-old son, actually, let me back up. Your husband dies in this hit. They pull your son out of the rubble, and his name is Yasin. He's lost both his legs, and he's in the hospital. We operated on him. We would clean him out every day. For those of you who are physicians or healthcare, every single surgery that took place is infected because there was no way of doing things in a sterile fashion. So we were there every day taking patients back and cleaning their wounds. There's pus coming out of them. Yasin, they didn't even close his stumps. When you do an amputation, they couldn't even close it. So it was open. You could see the bone. So we would take him to the operating room every single day, and we would wash him out and then put his dressings back on. And as everything is getting infected, so people don't realize, right? People only are talking about the deaths, the people who are dying when the bombs and the strikes happen. What about the people after that? Due to the lack of follow-up surgery, follow-up care, there's the second wave of deaths that's taking place, and we fear that Yasin would be part of that. We were able to arrange and work with another great organization, it's Heal Palestine, and we were able to arrange his transfer to the United States. This is Sharik. He did his residency here at the University of Rochester. He's a vascular surgeon. He lives in Atlanta. He convinced this hospital to accept him. We worked with the State Department, Heal Palestine, the other organization that does evacuation of patients. We have him ready to go, and then Rafah happens. Rafah happens, and Yasin is still there, and I pray every day that inshallah he survives because he's going to get infected, and he's probably not going to make it if we don't get him out. But this is Gaza. This is Gaza. 22-year-old Ahmed comes in and he's pulseless, and he got hit by artillery strike. That's 4 liters of blood in that jug right there. We had to put chest tubes in immediately, tried to save him. So I put a chest tube in, we got him ready, we got him to the operating room. We crack open his chest, Sharik did actually, Dr. Siddiqui, and his aorta was ripped off his ventricle, and obviously he was dead. He died right there. The tamponade in his chest was keeping him alive. That's how he got there. When we opened his chest, Ahmed died. So you want to ask what Gaza's like? This is Gaza. This is the emergency room at European Gaza Hospital. We would 800 to 1,200 patients a day come through this place. European Gaza Hospital is not like a Strong Memorial Hospital. Think of it more like a F.F. Thompson in Canandaigua. It's a small suburban sort of hospital. But every major health hospital has been taken out. And this is the only hospital now that you can actually do anything in all of Gaza. And there is only one emergency medicine doctor that works there. He's been living there for 200 days, doesn't see his family, doesn't see his kids, and every day sees patients. What people, again, I was talking about, you know, the deaths that are taking place that you don't see in the media, you don't know about. Well, there's another type of deaths that are taking place. It's from just regular ailments, diabetes, kidney disease, asthma. Every single day we would pronounce people dead in that emergency room because they didn't have access to normal, regular health care. When we are sick, when you are sick, when your child is sick, your parents are sick, you go to urgent care. You go to your doctor's office, you call up. Well, Gaza, I've been there many times. You could do the same. You could go see a doctor. You could get your antibiotics, get your medicines, go to your dentist. She had a dental abscess that is humongous, and we're scared that she's going to get a meningitis because there's no more dentist offices. There is no existence of healthcare outside of a hospital. This is Mustafa. He's diabetic, type 2, so he took metformin or glipizide. You know, I think almost everyone knows the medicines that I'm talking about, even if you're not in healthcare. It's a simple pill you take to manage your diabetes. For the last 4 months, he's had no medicine. He has no access to healthcare, and he developed gas gangrene of his foot. So that's his foot. Gas gangrene is an infection where it just starts eating away your tissues, and it actually makes gases in your tissues. You push it, and you could feel the bubbles of gas. Obviously, Shark and I looked at each other. We knew he wasn't going to make it. But the media won't tell you about these people. Many of you don't realize that these people are dying also. You just know about the bombings and the strikes, but every day there are deaths taking place that have nothing to do with what's dropping, but it's with the annihilation of the healthcare system. So we operated on him. We amputated him. 6 hours later, like we expected, he passed away. Just because he didn't have access to his medicines any longer. This is what's happening in Gaza. It's just people are dying from things you don't even think about because no one is telling you about them. So I'm here to tell you what's happening there. This is Gaza. So this is this is the one patient, so I can't remember her name. I'm going to share with you. But imagine the children, right? The kids. They go out and they look up to the sky, and at times they have to wonder if this is a bomb falling on them or part of the aid from the United States food. This little girl had the pallet of food fall on her, and she had traumatic brain injury. She's dead. She was just surviving on the ventilators. And that's Azim. He's one of our team volunteers. He's a pulmonary critical care doctor in Charlotte. And he would spend hours there just reading Quran and sitting with her and working with the family and trying to explain to them that she is brain dead, that she is not alive any longer. And finally, she passed away. But children have to look up and wonder if it's a bomb or if it's food that's going to kill me. That's Azim doing a final sort of neurologic test on her before we let her pass away. I think we're in the ER looking at CT scans on our phone we took pictures of. This is Gaza, and I shared like in the video where, Cengiz got that video when I exited from Gaza. I think we just gotten out and we were at the hotel in Cairo and talking. And, you know, as healers, as a team leader, as, you know, my goal was very crystal clear and focused. And a lot of people ask me, how do you deal with the emotion of it? You don't. You find purpose and you just keep working. Yes, we would declare someone is dead, move on to the next patient and start working. You know, you don't have time to process. If you work with emotion, you can't focus on trying to save people. But for me, in the multiple times I've been there, and I shared you, I really was in I can't explain it. I don't think no one in my family knew it, but I was really in a bad place for a few months. And as I shared in that video, when we started doing aid, I found purpose, you know, because I go to Gaza every year. I'm there, I know the people there, I know the doctors, and you make friends, and I was worried about them if they're alive. But this was probably the most rewarding part of my trip was, this is Munir, he's a surgical tech, he worked at Shifa, and I had not heard from him for a while, and just walking in the hallway of European Gaza Hospital, he sees me, he goes, Dr. Ismail, and I saw him. So, you know, and that video what Cengiz caught was, you know, it was, for me it was therapeutic to go back just to see the people that I hold dearly. This is Hussein in 2009 when we went, he was a student, and he took us around, and he was with us, assigned to us to make sure we you know, could move around in Gaza safely and go where we can. He's lost 40 pounds, okay? He was a big guy. He's lost 40 pounds, and he was, I think, laughing. He was like, you know, it's the Gaza diet. You still find, I know it sounds sarcastic, but this was his words. You know, he's like, at least I'm losing some weight. Because he was pretty overweight. Last time I saw him, I joked about him that he had to lose weight, so he was just getting into that. But I got to see him. That's Sharik. He was with us in 2009 there. This is Salim, and I think, you know, the staff know I shared a lot about him because for 3 months I didn't hear from him. And Labib is there. He was there with us in 2009. First of all, look at him. He's lost about 25 pounds. He's in disarray. His hair is not well done. But I tell you, Salim is the most dressed impeccable. He'd have his shirts always ironed, his hair is done nicely, his beard is trimmed, he speaks perfect English. I mean, he's like a GQ type of guy. I should have put a regular picture of him and see. And to see him, you know, I literally, I just was amazed. I felt like crying when I saw him, out of happiness, but out of like, this is my friend. He's living in a tent now in Deir Ballah. Someone who would, I mean, Salim, I could share more about him. He's like the best dressed guy I've ever met. And now this is him. But alhamdulillah, I got to see them, and you know, that was really rewarding to see all these people. Again, you know, Gaza, there's something, you know, one word, if you ask me one word to describe the people of Gaza, the people of, you know, Philistine in general, but Gaza is different. And no disrespect to anyone from West Bank, but Gaza is different. It's resilience. One word, resilience. No matter what happens, what happened, what was going on, it was alhamdulillah, it's Allah's will, we will get through this. And the doctors, my friends there that we made new friends this time. This is Dr. Ahmad. He's just sitting there. I think Azim took this picture. It captures everything. There's an ambulance behind him, and take a look at him. This is Dr. Ahmad. He's a pediatric emergency medicine doctor. He's been there for 200 days, just working, trying to serve his people. This is a mass casualty event, and it's a video that I captured to capture the resilience of these people. There was a strike that took place. His whole family was taken out. But he was steadfast in his faith, and he shared a message he said he wanted us to share for all of you.
I am Rafat Radwan. We are a family. Me, my family, my father, my mother, my sisters, my brother and his wife and his children, also our neighbors. It's okay. They come from Gaza, live in our house also.
In Rafah.
Yes, in Rafah. We are sleeping, or some go to sleeping. They are destroy us with a rocket. My brother and his wife and his all children, 2 daughters and 1 son, are killed. استشهدوا إن شاء الله رب العالمين. Also, my sister's son are killed by them. We don't do anything. حسبنا الله ونعم الوكيل. Our Gaza and all the health sector need your support. There is many injury and there is a shortage in medical supplies. We all need your help.
This is Dr. Abdullah. He's an emergency room doctor. He lives in his call room. He's been there since the war has started. These doctors have families. They don't have homes anymore. Their families are living in tents. He doesn't see his children, his wife, or anyone. He's not getting paid right now. There's no system to anything happen. But he works day in and day out to serve his people, to find purpose, to do something for his people. And we were just amazed. And Dr. Shazia was a girl right there. She's an emergency medicine doctor. She worked day and night. If there's anyone on our team that is a rock star, it's her. She would spend 18 hours in that ER. We would be like, okay, it's time to go. She's like, no, Dr. Abdullah's all alone. I'm going to stay with him, and I'm going to see patients. Imagine your college son or daughter, they get into, they're studying. These are medical students. So let's just imagine now your child gets into medical school first year. First of all, as parents, you're going to be so proud, so relieved. They're in medical school. There are no medical schools left in Gaza. They've all been destroyed. Everything that is sustainable for society to prosper has been taken out. Gas stations, clinics, dental clinics, hospitals, universities, schools, everything has been taken out. And these poor medical students have no future, but they're still smiling. And they were volunteering and in the hospital working with us as Sharik. They were on the vascular team. And they said they'll find a way. They will become doctors, and I know they will. But I share, because I've been there so much, if you ask me about the destruction, it's like a nuclear bomb has hit the place. Nothing is standing anymore. This is Azim and Shazia. They got up one morning really early, and they went in and they gave blood and donated blood, and the children are there with them, the girls there. So probably the best part of the day would be the children. I can't explain why, and I share with my family and my parents. The most thing I miss about Gaza, it's the children. We would walk in and out of the hospital, and there would be children there. We don't speak great Arabic. I've learned some after all my trips to many different Arab parts of the world, but they would be there waiting for us. The children would be there, and they just wanted to say hello. Sarah, I don't have a picture of her. She literally every day would wait and walk me back to my room. And, this is the resilience. These children will bring Gaza back. These children will grow up to make a difference, inshallah. But then I look at it, and as I shared, if there's no schools, there's no college, there is nothing left for normal society to function. Mahmoud and I were talking on the drive over from Buffalo. I was explaining to him, there is nothing left. And then you wonder, what is the future for these children, right? Again, these are things that the media is not going to talk about. But they're casualties while they are alive. They're casualties of this war because their future has been taken away. And many of these children are orphans. Many of them have lost either a father, a mother, or someone. But alhamdulillah, they would smile and hug us. And it was the best part of the day would be to see the children.
Oh, very nice. Hello, how are you? Hello. Dr. Shadi, go to Dr. Shadi, go. Hey. He has chocolate! He has chocolate! He has chocolate! He has chocolate! He has This is your fault. Oh my goodness.
So there was one day we didn't have all this going on. We didn't have chocolates or candy, and they were like, hey, because we'd give them candy every day. So I told them Shark had all the candy. It was like literally he couldn't get in. But alhamdulillah, this is the brightest part of the day, was to see the children. You know, it was you know, something I missed dearly. But now that I'm back, you wonder, are they going to survive? Which of these children will be still alive in a month, in a week? So right here is a picture of me. On the left, if you're looking at the picture, is Abrir. She's 11 years old. And on the right is Talal, and she is 10 years old. You know, they just look at them. Beautiful little girls. Talal, the girl on the right, shared her story. And I think one of the med students was with me and translated. And these girls would always wait for us too. They would come by the operating room and just send in messages, say salam to the doctors from America. Actually, about 2 weeks ago, one of the doctors from there sent me I should send that to you, Chenge. Sent me a video, and it's both of them just saying, we miss you, Dr. Ismail, come visit us again. But the story again, let me get back. Talal on the right, her house was hit. You know, if you want to know what Gaza is, her house was hit by a drone strike. She was thrown out her window onto the street, and her grandparents, her parents, his brother and sister, everyone died. No longer. And she was telling me this, okay? Here's a 10-year-old girl sharing with me this, and she now lives with her aunt on the stairwell. So go to Strong Memorial Hospital, don't take the elevator, open up the doors to go up the stairwell, and imagine people are living on the staircases. That's where she lives now. But the resilience of Gaza, the resilience of Palestine, their strength and faith, she wasn't crying, and I started tearing up as she's telling me the story, and she said, stop. She literally just tapped me, she goes, they're martyrs, alhamdulillah. So that's the story of Gaza. More children, you know, just sharing with you the future, the children. They'd wait in the hallway, so that's again, people are living there. And, you know, and every one of us, there was 4 of us on this team, and I think we all had our following of children that would be with us every day. And that was the toughest part of leaving, was just, you know, like you wonder because you have your own children, and, you know, you wonder if they're still alive. This is Yusuf. Yusuf had no shoes, no sandals, and he would walk with us and help us carry bags and luggage every day. And, you know, the last day we were there, I went out, got him, he wanted sandals, so I found him flip-flops. And then I think it was Sharik who gave him his regular shoes, and he was just so happy, and we had a bag of candy for him, and he was there. This is Hassan. He's a second-year dental student. He's a translator. This kid is bright, you know, like as we grow older, you know, you just know it when you meet a kid. You meet somebody like this kid is smart. That's Hassan right there. He is smart, but he has no more dental school. He has no more. And he messaged me yesterday, actually, and he was like, you know, can we look into going somewhere else, maybe go to, his sister goes to dental school in Pakistan, so I told him we'll try to see if we can find some connections there. But imagine your child's future is no longer. Again, that's what I'm trying to get to the message at. Of this is Hassan, right? He has no future in Gaza right now. Imagine your child These are things that you don't see or understand because you haven't been to Gaza, or you don't think about it because no one will tell you about it. About how the society, like I keep saying, a sustainable system for society to function has been eradicated. This is Shazia. I think she brought those sticky tattoos, so they all raided her room, and balloons, I think, the last night. So we spent a lot of time with the children. I think in our subconscious, you know, again, we're not emotional there. We're focused. You're just like laser on point, you know. Mahmoud and I were talking, you know, you get in the zone, right? You're in the zone. And that's what we did as doctors. And the children were our time to relieve it without emotion, but just to have I mean, they did more for us than we probably did for them. This is Tima, the girl sitting, when you're looking at it, right in the middle of that painting or drawing. She's 16, same age as my daughter Zahra, and she's an amazing artist. She lives in a tent, and she just draws every day. Laura draws pictures, and Shazia saw her and then started talking to her. She speaks, you know, she speaks very good English, and so she came over to show us her drawings. And as she was talking, she's like, "I'm going to make each and every one of you a drawing, a gift for coming to take care and help the people of Gaza." So right here, what I'm wearing, it was a drawing that she made for me, and Drew, I have it in my home. It's framed. So we decided to make T-shirts out of it, and we're selling them because obviously everything goes to Gaza. But you know, if you read the message, they're out there. You'll see. You know, it's I think it's something that I hope everyone you think about getting one. So this is her cousin, who's a shaheed, a martyr. We were just sharing some of her artwork, looking through the wall to the other side. Right? Look at those eyes. It's like, why do I don't have those rights? Why can't I have that kind of life? This is Gaza, right? This is Hala. Take a look at her. If you have a daughter, a niece, a granddaughter, 4 years old. She had 30% to 40% burns all over her body. She was burnt down to her femurs. That's the big main bone in your thighs. You could see her femur bones in both legs. We would operate on her. She was infected, cleaning her out. I took care of her one day. And there was another doctor, Dr. Sayed Mujahid. He was with another organization. He worked day and night. He was a plastic surgeon. He was a hafiz. She had no pain meds. He would sit at her bedside, stay in the ICU, and recite Quran. You know, we had a beautiful qiraat and recite Quran for her. And I reached out to Steve Sosaby. And many of you probably know Palestinian Children's Relief Fund. Steve Sosaby is the founder. He's a good friend of mine. He left the PCRF and started Heal Palestine, and I'm on the board for that as well. So it was really helpful. I called him. I said, we need to get her out. She started getting sick and septic. She needs to go. We got her to permission in Shriners Hospital. They were going to accept her. Steve worked his magic, right? You're a Palestinian. You don't have anything besides an identity card. And the passports are made in Ramallah, but you're in Gaza, and you can't just drive through Israel to go get your passports. And you don't have any family. You need a family member to go and get your passport. We got her passports. Steve did, right? Heal Palestine got her a passport from Ramallah. Now that passport has to come to Cairo. And from Cairo, you have to find a way and get all the permissions to go across the Sinai, the Ministry of Intelligence, and all these things that you have to do to get through Egypt. Got it to Rafah. We had exited. We left on the 24th. But, you know, Steve was like, we're going to get her out. And she was transferred to Rafah because the next day or 2 days later, they had the evacuation set up. She was going to get to Cairo, be flown to Shriners Boston, and she passed away. And, you know, like I said, you know, you get really focused in the zone. You work hard. You don't let emotions hit you. And I'm back for 3 weeks, and I heard about her last week on, I think, Saturday, that I got news that she died. And that's, I think, the first time I just let out my emotions. I went to my room and just cried. But the problem is, There's hundreds of Allahs. So you ask me what is God like in Gaza? This is Gaza. This is a video my last day. I just made it for myself, and I shared it with our team. I got up, we're leaving, and like I said, we wouldn't have left. You know, Saad Bhai, our director of operations, you know, we all knew Rafah was going to happen. We just didn't know when. And obviously our team, I'm sure many of you, our family, friends were worried, are you going to get out or not? And I remember looking at Sharik the night or 2 nights before we left, and I think Zahid Bhai had messaged me. He's like, hey, there's chances Rafah is going to be happening soon. What are your plans? And I was like, we're going to stay till we finish. We're not leaving early. And he goes, yep, just wanted to let you know. You know, and alhamdulillah, it didn't happen, so we got out. But I remember looking at Sharik, and he looked back at me, he goes, if that happens, alhamdulillah, we don't have to leave. And we can't get fired from our jobs. We can't get, you know, lose our jobs or this and that because we can't get out. And we're like, we were almost hoping it would happen so we could stay and continue to help. But alhamdulillah, you know, we're home and we'll go back. But then the day I was leaving, I just made a little video here. I'm getting ready to load up, everyone. It's sad, it really is. Didn't think it would hit us or myself like this. As I'm thinking about leaving here.
Hello. Hello.
See the kids? That's the typical routine. I'll miss that every day. Just saying hello. You know, I always say the best the best of diplomacy is through humanity, and I think our team excelled in that. It showed love, compassion, empathy. It made a difference. So we'll see you again, Gaza. Yeah, I think I said we'll see you again, Gaza. I'm just talking to myself, and I had to stop it. But inshallah, we will. Our plan was to go send teams every month. I'll do a little question answer at the end after everything, because I know people have questions. But you know, then Rafah happened, and you know, now everything's sort of back to square one in terms of entry and exit. How many of you seen the video? It was on social media of the tank running over this sign. Many of you have seen it. Some of you haven't. But if you go on social media, how many of you seen it? Yeah. We were probably one of the last teams to take a picture of that sign. I don't know why they had to run over the sign. It's because everything that is done, it has a purpose. Don't think it doesn't have a purpose. It's a purpose to break you down mentally, economically, militarily, every facet of life. So, you know, with that, I wanted to thank each and every one of you. I know it's a long weekend. There's weddings going on and much going on. You know, we were doing Buffalo last night, so it was only natural to come to Rochester. You know, with Brother Mahmoud joining us, and so we wanted to do Rochester. I thank each and every one of you for being here. Something that I probably don't do enough is thank my family, thank my wife for letting me do this, to go. And Uzma is actually in Amman, Jordan right now. She's volunteering to take care of Syrian refugees. So she is there with my son and Zara are there. So that's why she's not here. She's actually went on a mission herself with Imana and took the kids with her. You know, like I was sharing when I was preparing for this, a lot of people ask if you're scared, worried. I think I was oblivious to a certain extent, and I shared a lot with Zahid Bhai. Many of you don't know, he's our director of operations, but he's also my cousin. You know, you just get focused on a task, and you don't see what's around you. And it didn't hit me that anyone is worried or what. You know, I don't, like I said, I was probably oblivious. I was just like, I have to get in, I have to protect my team. I was focused on taking care of my team first and foremost, that nothing would happen to them. And at the airport in Toronto, my daughter Zahra, you know, she's a pretty strong girl and had I didn't know it was bothering her that I was going, because I probably didn't take the time to even ask how they felt. You know, no one in my family said don't go, not my mom, not my dad. Everyone I think was happy and proud that I was going, but I was oblivious to their you know, their pain or worrisome. And then, you know, when my daughter broke down and started crying at the airport, I still was like, what's going on? Why are you crying? You know, he still didn't get it. But I don't thank my family enough for this. They allow me to do this stuff. They support me, so thank you. The staff, behind the scenes, none of this would be possible if it's not for Cengiz, right there, for Zahid Bhai, and Nida, and Asna. I mean, these people are like family, and what I didn't realize was how worried they were. And I found out afterwards, you know, so a lot of the communication, those voice memos, you know, I would send a voice memo to Zahid Bhai. He was our director of operations. He was in charge if there's a catastrophe, a problem, you know, something happens. You know, we have our operation procedures, what to do. And there was times, to much of the dismay and of the team, I did go through Khan Yunis to deliver supplies to Aqsa Hospital, Dar Abdullah. I set the rule that we would not go, team will not leave the hospital, not go any places, but that rule doesn't apply to me, Zahid Bhai. And I told him, and Nida shared this afterwards, and that Zahid Bhai would be up all night worrying. She said he had sleepless nights when he knew that you were moving around. And, you know, I had two moments. I think the first time I realized where we were and coming back out was when the team all got on the planes. I stayed an extra day for meetings with the WHO, and I got a message from Zahid Bhai, and it's a text message, right? But I could just tell from his tone, he was like, Alhamdulillah, you all are safe and fine. And that's where I shared a private text with the team. It finally hit me, and I could tell just from that message how worried Zahid Bhai was. And I thank you, and I love you, Bhai. You know, he was worried, Dida was worried, Cengiz was worried, but alhamdulillah, we weren't worried. We were fine and happy to be there, but thank you guys for everything. I want to thank Soha, Ayan, and Lena for putting all those bags together, 42 bags, coming up to the house and packing with Zara. I know Sohaib is back there in the Hornell community. You know, my community down in Hornell, we packed and then moved stuff, and the kids came up and spent time with us. So thank you guys, because you made a difference in lives. Don't think that it was just you did nothing. You were part of everything that you saw and those people that were saved and touched. I know I have long thank yous, but these have to be said. Homa, Asin, Tahir, and Shabana, I know that you guys were there for Uzma and the kids. Again, I'm oblivious to this. I didn't care, like, just do it, but I know that you guys, you know, you are like my family, you are family, and that you were there for Uzma and Zara and Ibrahim and the kids, so I thank you guys. I thank my sister, my brother-in-law, my brothers for everything, because I think they will mask their worriness, but they're always there to support me and take care of Uzma and the rest of my family. And Yusuf, who did the Quran recitation, is my nephew. And I remember I heard about this a little bit later. I think Uzma was telling me he went to his mom, to my sister Rabi, and said, I don't want Ismail Mahmoud to go. I'm worried about him. I don't want him to go. But, you know, Yusuf, alhamdulillah, I'm back and I'm here. So you don't have to worry. I want to thank all the volunteers, the donors, everyone who's donated as part of this. Literally, people, mothers and people in Gaza, when they would start, people would raise their hands and they would make dua when they find out that we're Muslim and we're here to help. They would pray for my grandparents. They would pray for our parents. Like, the duas are so beautiful, and they're long, but they're beautiful. And the translators would be telling us what they're saying, and then we'd stop right there and we'd say, this is not possible if it's not for the donors. Then they would start all over again and say, for the people who have given for this, their grandparents, their mothers, their fathers, they would make these beautiful duas. And for each and every one of you that's donated and has supported this work, this is a part of you. And I have complete faith that inshallah on the day of judgment, it'll be the Talals, the Abrirs, the Ahmeds, the Mustafas that will go to Allah subhanahu wa ta'ala and they'll say, Ya Allah, this person donated to help me, to save me, to protect us, to help us in Gaza. And that might be the difference for the scales to go from the right to the left. So, you know, none of this is possible without the donors, and I thank each and every one of you.